thank you for your kind introduction, Maria, and for realizing this fantastic event. I wouldn't have dreamed about engaging 73 people on this Tuesday night here. So I'm so excited about that. Thank you all very much for coming. So I'm giving a tour de force through the female project and how it came alive. And then three very talented early career scholars will give us some dimensions from social science. And I'm really happy about this because this is, I believe, actually where our project could stimulate a lot and create some synergies with these scholars. And myself coming from humanities, I also acknowledge that I believe health research actually could be inspired a lot by social science and humanities. So I'm really happy to have you here all. So my take-home messages, just to start in the end, is all about the context. So Maria already talked a little bit about the context for endometriosis, and largely it has been ignored in government policy and research funding globally. We have seen some optimistic trends in recent years, but largely it's been under-prioritized, underfunded, understudied. Then we decided, I'll come back to this a bit later, to dare to submit this Horizon application, and we actually got one of these projects, and I'll just contextualize that program because this female project is actually a really tech-heavy project. So I'll come back to that a little bit. And then about the project itself, the context is also that we will actually apply state-of-the-art project management tools because we acknowledge that if we should change anything, we need to base our tools about actual human behavior. So I'll come back to that as well. So just really happy to be in this panel with some great social scientists. So as you might have heard here for a few weeks ago, France actually launched this national plan to fight endometriosis. And the 5 pillars in that presentation is actually about raising awareness, strengthening the training of professionals, improving detection of endometriosis, ensuring personalized care, and fostering research and innovation. So that's really, really good. And we have seen some tendencies already in Australia and the UK. Scotland also has promoted women's health, and now in France. So we see this evolving globally. Now Canada is also launching an action plan. I don't know if Eileen will comment on that later on, but that's at least great to experience. And so one of our advisors in the project, Marina Kraskov from France, is actually posted about this on LinkedIn. So what does this national strategy actually means for endometriosis research? And she mentioned these 3 pillars. So with this national French endometriosis plan, they hope to structure and develop dynamic research, to develop epidemiological knowledge on endometriosis, and to foster innovation, as you saw before. And that's really good news. It's much needed. But as I mentioned, I come from humanities. I'm a historian, actually. So what about context and what about the processes? And this recent paper actually emphasized that since we have associated endometriosis with menstruation and women's pain, that actually leads to that ideas nowadays about women being somehow accountable for their own illnesses. So, of course, this is a key dimension in guiding health research. And ultimately, the paper concludes that we need to keep paying attention, illuminate and critique endometriosis to really gain social and political awareness and observation. So yeah, we really need to pay attention to context. So that's just a little bit about endometriosis. Now moving on to the female project. So as I mentioned, it's actually a tech project. It's embedded in the program for individual awareness and empowerment for self-management of health. And the topic was about personalized early risk prediction, prevention, and intervention based on AI and big data technologies. So how does that correspond to endometriosis? And actually, Mia, who will end our tour here tonight, I onboarded her here in the research unit of general practice in Aarhus, and she really paid attention to endometriosis in her own study, and I realized this was actually something I've never learned about before, but was a huge problem. And myself being interested in digital health research, as Maria presented initially, I came about some quite interesting white papers. So can we use algorithms basically to detect undiagnosed patients? And I think it's just fascinating, you know, can we by these so-called digital footprints, can we do something there to reduce, in this case, this very much delayed diagnosis? So that was just, you know, the initial sparks. And then, of course, also we've seen this change from a population perspective, you can call it, to a more personalized. And what's interesting there is that we see ideally a combination of many data sets, multi-omic data sets, into the idea of tailoring the various digital health services to personalize them. So it's just part of that movement as well. So what we're trying to do with this female project is exactly then to personalize the early risk prediction of endometriosis with an aim to ensure individualized intervention and to build knowledge for prognostic prevention by identification of subtypes of endometriosis. So again, in this tech, you know, personalized framework, that actually makes sense. So the ambition for the project is to develop this platform where we actually are able to convert these population data sets into a personalized predictive model and to improve the continuum of care for women with endometriosis, and, you know, also in a broader sense, any patient with endometriosis. So the framework about this, we had huge help from Luna Homicide to draw this up, is that we basically want to engage on multi-levels. So we have the patient level, where we try to apply this Lucy application to guide health-seeking behavior. That's part of a way where we can reduce time to diagnosis. And the other one, of course, being to basically train the healthcare professionals, general practitioners in particular, to be aware of other opportunities and to refer if needed. But it's not enough just to identify. We also need to be much better to detect and to diagnose. So we are also trying to develop and to at least test in this project some really state-of-the-art tools, both for GPs, as I mentioned, based on risk stratification on biological data, and also to help gynecologists and radiologists to ideally diagnose non-invasively. But in the end also, we need, of course, to improve treatment. And we have two state-of-the-art opportunities here. One is to try to digitalize mindfulness intervention, because this has proven quite effective in improving quality of life in other contexts. So we'll be exploring if this actually also goes for patients with endometriosis. And then what I think is really cool, we try to train this algorithm so that surgeons can be guided visually, preparing surgeries and actually while operating. So again, it's really tech heavy on multi-levels, but ultimately it really improves this continuum. So how would this create value? So ideally, we will enable shared decision-making in both primary and secondary care. As part of this personalized pathway, raise awareness, increase health literacy and empowerment, with ultimate objectives to improve quality of life in patients with endometriosis. So a key feature about quality here is basically that we cannot conduct quality of care without accuracy. So this is, I think, one of the most important topics of tonight's discussion, how to ensure equity. And that goes, of course, in how we carry out our research, how we develop our new tools and services, and does that really reflect an inclusive society? So I think that's really going to be interesting. So the female project itself is for 4 years. We've been granted close to 6 million euros. We have 17 partners now. We just completed the first year in the project. This word cloud is actually from our kickoff meeting, where we tried to identify what would it take for us to succeed with this project. And as you can see, we need enthusiasm, collaboration to drive this. And I think it sums up quite well what it takes to be successful in such an interdisciplinary and international project. We have 17 partners across Europe, scattered all over Northern Europe, British Islands, Southern Europe, Eastern Europe, etc. So I think it's a really nice consortium, and it comprises of universities, university hospitals, patient associations, startups, NGOs. So yeah, a nice variety of partners here. So the project itself is structured in 10 work packages. So the research and innovation, the core in the project here is in these work packages 3 to 8. In 3, we try to describe the prevalence of endometriosis based on state-of-the-art population study in Denmark and registered-based data analysis in Denmark and Scotland, the geographical distribution, the socioeconomic consequences. In work package 4, we try to understand if there are any subtypes of endometriosis based on biological data, and if those could be translated into this clinical decision support tool for general practitioners. We developed this Lucy application in work package 5, and we also add to this a data collection module so that we can actually build a prescriptive cohort and learn much more about the environment and your everyday activities, what's going on there. In 6 and 7, we are building this augmented reality tool, like I mentioned. So yeah, very exciting, very futuristic in many ways, but it makes a lot of sense. And the mindfulness program, the digital mindfulness program is developed in work package 8. So this is like the core of the project. And then what's interesting that around this, it's embedded in this framework where we really try to make early impact. I'll come back to that a little bit later. And then basically to make our research and innovation responsible. And this is where equity, gender, open science is not just buzzwords, but really makes sense. And, promoting a democratic Europe. So we're trying to do this and also utilizing citizen science in this, really trying to do our research together with as many stakeholders as needed when we can. So yeah, quite interesting. And then of course you have project management and communication dissemination activities around this. So it's just really trying to sum up or boil down this project. So communication means a lot for us. So we've been quite successful already. We are so far on Twitter and LinkedIn and Instagram. We have a YouTube account where this presentation will also be uploaded to. So feel free to engage with us, to use these materials to promote not only the project, but of course, the whole course about endometriosis and reducing this diagnostic delay. So this is the project in a more linear presentation over 4 years. These work packages, what are we trying to do across the various tasks? And so we are also keeping an overview of all our deliverables in the project. So, I mean, it's a bit chaotic, it's a bit, overwhelming, but still it actually makes sense, if you just break it down into small work packages instead. So here in the end of my presentation, I'll just talk a little bit about the projects, and we have utilized this half-double framework to realize early value creation. And it has these 3 components of impact, flow, and leadership. So we try to establish a nice rhythm in the project so that we meet regularly, and we, sorry, the light just went out here. I'm obviously just standing too still. So yeah, we're trying to realize a nice rhythm in the project to meet when needed, and to promote the work package deliverables. We try to also reflect upon impact. Can we do anything to change this? And this is really interesting, since what do we do when a software engineer is actually going to discuss this with a psychologist? So very exciting indeed. And we're also trying to promote some more collaborative leadership here, since this is the only way, to make people change. Again, this was like actual behavior project management tool. So we're really trying to do this, and it really seems to work well for the time being, and it's a lot of enthusiasm. We also sense that there's actually a nice awareness on a more policymaker level. So this post, for example, here we have a member of the Danish Parliament interacting with one of our LinkedIn posts. So yeah, it really pays off to be there and to take part in this dialogue. So I think I'll just leave it for now. But you're more than welcome to engage with us. I hope this was a bit context about the project, and I'm sure Maria and Eileen and Mia will explore that much more.